Hey, everybody, it's Natalie Bencivenga. Welcome to another edition of Facts Over Fear. Now, on this show, I think you guys are probably pretty used to topics that I like to discuss. And anytime I get the opportunity to discuss what's going on in our healthcare system and how it interacts with labor rights, it's going to be a good conversation. So let's kick things off because nearly 900 nurses and advanced practitioners at UPMC Magee-Womens Hospital are launching historic first contract negotiations aimed at strengthening women's and family health across the Pittsburgh region, no matter where you live, whether you are in Pittsburgh or anywhere around the country, because I know there's people that tune in all over. This is important because this can often lead to a domino effect, as we've seen in other parts of the country. So it's important to still pay attention. Now, for the first time, McGee nurses are inviting patients, community members, and non union nurses to help shape their contract proposals through a public input process. I'm super curious to understand why they decided to do that and what that actually looks like. The effort reflects a broader push to address worsening maternal and infant health outcomes, deep racial disparities, and a severe nursing workforce crisis in Pennsylvania. Nurses say their goal is simple, but it is urgent to put humanity back in healthcare by ensuring safe staffing, sustainable working conditions, and more time for patients. I know my mom's going to be watching this as a former nurse and probably going, oh, yeah, as we talk about this. So, this moment marks a significant test of how labor, healthcare systems, and communities can meet this moment and come and work together to reimagine care for future generations. Here to discuss this with me is Lucy Ruccio. She is a neonatal nurse practitioner at Magee-Womens Hospital. Lucy, thank you so much for joining me.
Yeah, thank you so much for having me.
Absolutely. So before we dig into all the details of what's going on here, let's talk about your own journey into this field. Have you always wanted to be in what we call the helping profession? How did you find your way into nursing?
Yeah, I think that's a great question. Nurses certainly don't get into it for, money or prestige. So I think most of us have some version of, um, wanting to be helpers, wanting to take care of others, and also interest in science
Yeah.
and the human body and what we're capable of and what science is capable of. I think really drove me into being a nurse. I started in the emergency room very briefly and then very quickly found my home in the neonatal ICU. And I've worked in the NICU as a nurse and now a nurse practitioner for over a decade.
Can you talk a little bit about the difference between a nurse and a nurse practitioner?
Yeah, absolutely. So I think most of us are familiar with a registered nurse, generally
Mhm.
a bachelor's degree. They're the ones who are really at the bedside,
Mhm.
who do in my opinion, the hardest work of healthcare. And then a nurse practitioner has an advanced degree, could be a master's or a doctorate. And we can prescribe, we can come up with treatment plans, we can sort of manage independently our own patients.
So why the NICU? What was it about working in the neonatal unit that just stirred something in you? Because I know for every nurse I've talked to, there was some connection to a division of hospital care that really drove them
Yeah.
forward.
Yeah, I think I've always had an interest in how best to impact, the lifespan of someone's
Mhm.
health. And in the NICU, you get in the very beginning, right? You're there
Yeah.
at the birth of a new life, and you have such a huge role in shaping
Mhm.
the development of that person and that family unit for the rest of their lives. Um, in the most intense moments, often of someone's life, right? If you've come to the
Yeah.
NICU, something did not go right.
Yeah.
And so I think for me, I love the combination of the intensive care, right? It's an ICU. We see the sickest
Mhm.
infants imaginable. So the science and the precision is really intense, but also there's this caring, there's this huge importance of teaching and time taking with your patients. Right. So it's everything from micro calculations to get fluids just right, medications, and also teaching new parents how to swaddle their baby and
Yeah.
place a diaper on something they didn't know could be so small.
Absolutely. And when I'm listening to you talk about it's very clear that you're centering patient care, infant care at the forefront of the way that you work. But unfortunately, and I don't need to tell you because that's why we're having this conversation, that has really deteriorated as in the healthcare setting over, I would say, the last 30 to 40 years. And like I mentioned before, my mom was a nurse for my whole life. And I just remember her through the years talking about the chipping away and what they were
Mhm.
seeing, and less nurses being on the floor and less bedside care, and the things that she did as sort of an old school nurse that were sort of being phased out, and not because there was better things, quote unquote,
Right.
taking their place, but because it didn't match the bottom line. As we're seeing, more of these healthcare systems are turning really into just big businesses and being run in a way that isn't conducive to patient care. Can you talk a little bit about what you've personally seen in your journey around the deterioration of healthcare and how it sort of relates back to the corporatization of these systems?
Yeah, I mean, I think that's a great question, and this is a national issue, right? This
Yes,
is not just an issue at Magee-Womens,
correct.
um, but absolutely, more and more you know, the boards of directors of hospitals maybe have one medical provider on them. They're
Mhm.
mostly titans of industry. I know, UPMC board of director, I think, is made up of several banking, heads of banking institutions and steel, you know, people. There's one, I believe, physician on there. So I think more and more we're just losing the voices of frontline healthcare workers as our hospital systems become owned by insurance companies. And there's just more and more space between the people in the front lines and the people making the big decisions, which is really what this whole organizing campaign and unionizing effort at McGee has been about, is just recentering the voices of our patients and the voices
Mhm.
of our community and the voices of the people who are actually providing care and know what their patients need.
Absolutely. And we're going to get that into that in just a moment. If you're just joining us, I'm Natalie Bencivenga, and I am talking with Lucy Ruccio. She is a neonatal nurse practitioner at Magee-Womens Hospital. I just want to also clarify, if you are from outside of the Pittsburgh or Pennsylvania region, you may not know how this landscape works here, but there's really only two hospital systems that really dominate Western Pennsylvania. It's a UPMC and Highmark. And because of that, there isn't really a lot of choice, not for patients and certainly not for healthcare providers or professionals. So, using that as a little bit more of a foundational context, what makes this first contract negotiation at McGee different from some of the past efforts by UPMC nurses or in other spaces around the region?
Yeah, I think first of all, it's different because it's the first, right?
Yeah.
This is Magee Women's Hospital, which, for those who don't know, is sort of the anchoring institution of women's health in all of Allegheny County. We deliver more than, or about half of the
Mhm.
entire county's babies, 10,000 a year. Um, and no UPMC hospital has ever unionized under UPMC's ownership. They've
Mm.
acquired and bought some that were already unionized, but this is UPMC's first time really having to come to the table and sit across from their own employees to negotiate a first time contract. So, I mean, that alone makes it
It's
historic and
major.
unique. But I think the other thing that makes this contract negotiation and this organizing effort unique is we've really centered our patients and really centered the voices of our community. um, my husband was born at Magee Women's Hospital. I've delivered two children there. It's really a community hospital in that respect, and almost everyone in Pittsburgh and Allegheny County has some tie to it. So we've really tried to center the voices of our community and our patients, um, in our whole organizing effort, and now in our campaign to get a good contract.
Was this intimidating to do this? Because, like you said, I mean, I'm listening to you, I'm like, this is intense. I mean, this is, the first time this is happening at McGee. We know that this company, UPMC, they are not union friendly or interested
Right.
at all in what their employees. At one point, I don't even think they said they had any employees, right? So it's just, how do you deal with the level of resistance? Were you scared as a nurse practitioner, somebody who needs a job, who needs to
Right.
put foot on the table? to enter into this level of leadership, the willingness to come and talk to me. I just want to acknowledge your bravery in this. Can you talk a little bit about that personal decision that you made to say, I am stepping forward? And how did you pull other nurses along? Because it wasn't that long ago. And like I said, I grew up listening to these stories. And my mom would say to me, I wish we could get a union. I don't know if it's
Mhm.
ever going to happen. So what are your thoughts on that from a personal perspective?
Yeah, I think absolutely. I mean, it was intimidating. We thankfully had these incredible um, sort of sister institutions in the region at
Hmm.
Highmark, West Penn, Allegheny Health Network, or Allegheny General Health
Hmm.
Hospital, which is already unionized, and they really poured themselves into our organizing effort.
Hmm.
And I cannot say thank you enough or shout them out enough. I mean, we had nurses from other regional organized hospitals come to all of our meetings, but this has been ongoing for over a decade.
Wow. Yeah.
There are senior nurses at Magee who told me about 10, 12 years ago when similar efforts began in a, less friendly labor board kind of scenarios, and how scarred they were by the
Mm.
process, by how sort of violent the crackdown was.
Yeah.
And our organizing campaign took about 2 years from really getting going to being able to hold a vote.
Hmm.
Um, and there was a lot of fear. I mean, we got pulled away from patients' bedsides to be sort of disciplined or called, a bully, or, um,
Wow.
there was definitely concerning behavior, a lot of money spent and efforts and resources on UPMC's part to not see this happen. Um, I really believe in my community and I believe in the nurses around me. And so I took a lot of solace in knowing that they were all behind me. And so those of us who were sort of loud up front in the beginning and really sort of stuck our necks out, I always knew the nurses had my backs.
Mm.
So, but yes, it's been an intimidating process. And I'm so thrilled and I think still a little bit in shock that we're here. It was a lot of really hard work.
It's incredible because it's like your job is so hard and so demanding. And now you've got this other thing that's like another job on top of it.
Absolutely.
So I just want to acknowledge all of that as we continue this conversation. But, what else I found interesting about this, because I've not really heard much of other organizations doing this. Why was it important for nurses to invite patients and the broader community into this negotiation process? Can you speak to that a little bit?
Yeah. So again, I think we've really wanted to center the voices of our patients, right? I think, um, many would like to paint, efforts of nurses or other working people advocating for themselves as greediness, or, we should just be quiet and do our jobs. But at the end of the day, everything we do as nurses and in healthcare is for our patients, right? And we are this
Mhm.
community. The vast majority of us live in this community. We receive our healthcare at Magee and other UPMC hospitals. So it just made sense to ask for our community's involvement and make sure that what we were seeing matched what our patients were seeing as needs. And we launched this website that we're very excited about. It's called elevatingpghhealth.org. And I recommend everyone go check it out. And it's basically just asking for exactly that, for feedback, for communications about your experiences as a patient and as community members. Um, and we really have been looking at what we've been receiving already and sort of making sure we work that into our contract negotiations, because we know that everything we do now will have ripple effects to other area hospitals and also down to
Mhm.
our community.
I wrote it down because I will definitely be putting that in the Substack when this is over in case anybody wants to check that out, elevatingpghhealth.org. Let's talk a little bit about your current situation and why you felt you needed to unionize. How do your current staffing levels and working conditions impact and affect the care you're able to provide to people and family and infants that you're seeing every day? And talking a little bit about the racial and the economic disparities that we're already experiencing within the healthcare system. How did all of that factor in?
Yeah, I mean, I think it's just facts that our patient populations overall is sicker than it's ever been, right? Nationally, but specifically in Allegheny County, our patients really struggle with chronic diseases, more complex needs, and as rural and smaller hospitals are frequently closing their obstetric units, McGee becomes more and more a location for people to get their care, and they're coming from further, which means they have received less care before they get to us. So I think, our county has higher rates of C-sections. Our county has higher rates of low birth weight infants, cancer than our state average. Allegheny County's preterm birth rate has consistently worsened over the last decade. Um, and we're seeing severe maternal not mortality, morbidity, excuse me, where there's sort of serious unexpected complications during and around pregnancy rose by 55% in the last 10 or so years. And like you said, those, issues are even worse for Black mothers and Black babies, right? Black women are dying at twice the rates of white women in labor and afterwards. And same are infants born to Black mothers are more than twice as likely to die before their first birthday than white babies.
Oh,
So we really see these, every day in our practice, and it's heartbreaking, right? And I think some of this is hugely systemic, right? But as a primary anchor institution in women's care, it's our job to try to improve these things, and a lot of that just boils down to time with our patients, right? Adequate education, not having to rush through appointments. I think everyone's been to a doctor's appointment or an ER visit or an urgent care, something where you feel like you didn't get to have all your questions answered, or you didn't get enough time with your nurse. And even as someone who spent over a decade in healthcare, when I go for my own appointments, it can be overwhelming, and not having that time has these huge ripple effects for the health of our community. So yeah, I mean, this is a huge piece of really our number one ask and demand in this contract negotiations is for more time with our patients so we can adequately educate and make sure they're getting the care they need.
I think all of that is, well said. And I think, I couldn't help but bring into focus in my mind how all of these cuts now to Medicaid are also going to be further deepening this crisis because already, like you said, hospitals are closing. Obstetrics are not really considered profitable, right? So they're usually first on the chopping block in a lot of these rural hospitals. And now you're dealing with people who are already underinsured, a lot of us, and now you're dealing with people who are going to lose what little supports they had. People don't recognize that Penny is Medicaid. So you're in Pennsylvania, if you have Penny, that is up for on the chopping block as well. So all of these things interweave, and like you said, and then we factor in race and economic disparity and location demographically. And we see how this becomes this situation that is now boiling over. Let's talk about what is at stake here, because you've alluded to it, but I really want to hit this point home that McGee, like you said, serves some of the region's sickest and most complex patients and cases. So, what needs to happen in these negotiations for you to be able to do your jobs? What are you looking for outside of more time with patients?
Yeah, absolutely. I mean, I think we're really excited to sort of build this collaborative relationship with UPMC. It's
Mm-hmm.
new for everyone involved, right? It's
Mm-hmm.
been a very top-down approach, and now they have to sit and negotiate with us, and that's a different dynamic for everyone. But the things we're asking for, I don't think any of them are outrageous, right? We're asking for more time with our patients, which in order to do that means following existing evidence-based, nationally recognized staffing standards. So things like
Mm-hmm.
A1 has, patient ratios where it's, a specific in your eye. If you're in the intensive care unit, you should only ever have X number of patients to X number of nurses. These are based in science and evidence. They
Yeah.
improve patient outcomes. It's known. The other thing we want is, we're seeing this huge nationally nursing staffing crisis. And Pennsylvania actually has the worst one. We have 20,000 unfilled nursing positions. Um, and not all of that is for a lack of available nurses, it's for a lack of nurses who are willing to work in the current healthcare conditions.
Hmm.
Um, so I think things like making our healthcare affordable is high on our list, right? We work for an insurance company, and most of us, um, a huge number of us are in medical debt to our own employers.
Wow.
Um, and so I think just affordable healthcare, compensation that rewards experience, and is just more transparent, right? When we unionized and were officially recognized, we were able to request information from UPMC that we had never had access to before.
Oh, wow.
And one of those things was everyone's pay, right? And so we were
Wow.
able to graph it out. And while UPMC likes to say there's no wage cap for experience, what we see is a very clear penalty for experience.
Which
The
is
longer you
bizarre.
stay, yes, it's very bizarre, right? But I think it also points to the lack of healthcare voices at the top making decisions, right? A nurse is a nurse is a nurse to them, where
Mm,
we know that an experienced nurse, you know, can save a life much more quickly, can
yeah,
teach parents tricks, can do other things that a new nurse just hasn't learned yet, right?
sure.
And a new nurse should have that experience around them to learn and grow. Um,
Lucy, can I interrupt
mhm,
you for a second? Because I didn't mean to interrupt you, but when you said that, I was just like, oh, this is insane. But you had started to talk a little bit about almost a penalty for
yeah.
staying longer. Can you elaborate on that?
Yeah, so we see it pretty clearly in our charting of everyone's salaries that you in the first few years generally make pretty impressive gains in your salary, and that by about 5 to 7 years you've kind of capped out. Your increases become very small, often 25 cents a year,
Yeah.
um, and and so you basically stay, right? So the longer you stay, the lower your salary really becomes in
Sure.
relation to your experience.
Mm.
Um, and so we have this cyclical loss of experience. And then often we have nurses who stay for only 1 or 2 years before they just burn out. It's too morally distressing to know what you want to give to a patient and not be able to do it for lack of
Mm.
time. Um, and I think we think about moral distress and burnout as sort of an individual failing, like you couldn't,
Yeah.
you couldn't take it, you couldn't hack it in the real world, but that's an institutional failing, right?
Amen.
That's a systemic
Hmm.
failing. We shouldn't have anyone burning out because of moral distress, and we're seeing it at pretty epic proportions. So I think in some way to battle that, you know, healthcare, so we're not worried about our own families. I know high on my personal list is improving our parental leave.
Mm.
Currently, Magee-Womens does lots that is not obstetric and newborn care, right? We have incredible Women's Cancer Institute. We have orthopedics, bariatric surgery. But a majority of us work in sort of the women, family, newborn world. I've dedicated my life to taking care of infants, and we get 2 weeks of paid
Whew.
parental leave.
Oh
2
my God. You know, it's just the irony, right?
Yeah.
Because you work in obstetrics and we know most birthing people, you're still bleeding for 6 weeks on average. So the idea, and a family member of mine just had a baby. And so I think this has really been a focal point because I have been over there a lot to support and help.
Sure.
And I got to tell you, just and you're gonna laugh because I don't have an infant of my own, so it's all shocking to me, guys. But when I was over there and being of support to this person in my life and holding their baby so they could shower and take a nap and all these things, and I'm looking down at this little guy and I'm thinking, this is wild to me that I know women and other people who've had children that are expected to go back to work after a week or two when this little person is so dependent on you and you are so sleep deprived. And if you're breastfeeding, you are constantly, that's a new job that you now have. And like you're
Totally.
bleeding and your body is going through this incredible transformation. Mentally, you're going through an incredible transformation. And the idea that we are so fixated on just get back to work when this is work in and of itself is so offensive to me. And the idea that you in that field where this is all you're doing all day, you're bearing witness to this, and then you get 2 weeks. Oh my gosh, that would be enough for me to be out on the picket line, Lucy, minus all the other things. I'd be like, let's go. Like, this has to change.
Yeah.
And I just want it noted that there are other things happening at the state level, including the Family Care Act, where they are trying to pass a statewide paid leave program that is definitely more than 2 weeks. But this is, we'll see how that transpires. But in the meantime, none of this is sustainable, is healthy, is conducive to maternal or infant health. So, just astounding to me. And I didn't mean to derail us, but my
Yeah.
goodness,
Yeah.
you just blew me away. I gotta just say, you just blew me away. So as we're wrapping this up, I don't want to end on a rant, even though I just did a little ranting there. But when we're looking at a successful contract, what would that contract look like for the nurses of Magee? And how would you feel personally to say we've got a victory here? What would that need to look
Mm.
like? And I'm assuming paid leave is a part of that.
Yeah, I mean, I think there's, of course, the brass tacks of, better insurance, better parental leave, transparent pay scales, safety
Hmm.
and security.
Hmm.
But I think at the core of all of it, as you said in the beginning, our goal is to really put the humanity back in healthcare.
Yeah.
So, we're really fighting. It's been kind of incredible seeing my nurse colleagues who we're trained and taught to advocate for our patients. That's part of the, nursing education is the
Hmm.
formal education is how to advocate for your patients. But nothing about advocating for yourself, right? Or
Mm.
for your profession. And so seeing my colleagues take their dedication and advocacy for their patients and just balloon it and, be so empowered, to me, that has been, I think, probably the greatest gift of all. But, I think a win to us is improving patient care, improving the health of our community, and improving the health of our profession, right? So that
Amen.
people aren't leaving in droves, that we keep senior staff, that you don't just leave after you have children because who can go back in just a few weeks.
Right.
Um, so yeah, and
Eh,
UPMC is the largest healthcare system in Pennsylvania, the largest private employer in Pennsylvania. Not only do we know they have the resources to sort of meet our demands, but they have the moral responsibility to do so. Right? They're a leader in addressing problems, and they should, in women's health nationally, regionally, statewide, and they should be a leader in um, making our profession sustainable as well.
Absolutely. And I think that is so well said because it's this idea of you know, with great privilege comes great responsibility.
Yeah.
And if you want to be the top dog, then you got to be the top dog in all those ways that you
Mhm.
just spoke of. I also just wanted to add to my paid leave comment. Um, it's also important that the non-birthing partner has time off as well to not only bond, but to support the person that just went through a huge transformation because they too are going through a transformation. And if we want to strengthen families, if we want to center those units, then we have to take care of all of those people who are a part of that experience. So I just wanted to add a little
Right.
asterisk.
Right. And
And
of course there's many ways to be a parent. We
exactly.
have parents who are adoptive, who have
Yes.
surrogates. They deserve time to bond with their children as well.
Absolutely. Absolutely. Because at the end of the day, like you said, what this really comes into focus for me is this idea of people being centered at the policies that we
Yeah.
are creating. And this idea that we can't change things, this is just the way that they are. That's not true. Things
Right.
change all the time. And it just takes the concerted, consistent effort of people like you who are passionate about what they do and the communities that they serve to see this through to the end. So, I'm very much looking forward to seeing what you're able to make happen. I feel very connected to your cause. And if you want to come back and give us updates, I'm sure
Yeah.
everybody that's been listening would love to hear how things are going. I'll be posting this after probably tomorrow morning. So if you missed it or missed parts of it, don't fear. We've got a lot that we'll be able to catch up on. Lucy, if people want to support your efforts, I know you had mentioned elevatingpghhealth.org. I'll make sure to include that, like I said, but is there anywhere else that people can go to help support the nurses?
I think that's sort of the main place right
Great.
now, and that you can link in with that once you fill out the form on there. It'll link you into getting more information about our contract negotiations and other ways you can help. Um, but yeah, really, we're just really excited to be here, to be making this difference, and we have no intentions of striking or anything like that,
Sure.
but it's been pretty powerful seeing nurses around the country right now, sort of rising up and demanding a return to, sanity and humanity in healthcare. And we're just really excited to be part of this movement.
Wonderful. Before we wrap, do you have anything that you want to say to perhaps new nurses or people who are considering this profession? Because, like you said, this is kind of a critical time, and we are in a crisis here in Pennsylvania, and it does feel at times hopeless. But we all know that that's only a mirage. So, can you talk a little bit about anything that you'd like to share with them, particularly?
Yeah, I think, I live on the same street that Fred Rogers did and, in Pittsburgh. And I think, looking for the helpers in these hard times is so important. Um, and even better to be a helper, right? If you can be a helper, why would you do anything else, right? I come home exhausted, um, but I feel good about what I have done. Nursing is a unforgiving job, and I could not recommend it more wholeheartedly to anyone interested. There's so many places to fit in, right? I love the NICU, I love the tiniest babies. And then I have my friends who love the elderly, who love adults, bariatrics, whatever it may be. There's a place for everyone. Um, so I think be a part of the movement. Join us. We'd love to have you.
Thank you so much. I'm Natalie Bencivenga, and as always, everyone, until next time, take care of yourselves and each other. Thanks again, Lucy.
Thank you for having me.